We want to turn to the other big story this morning. This is true, and sometimes we use the word groundbreaking, and historic, but this is potentially quite groundbreaking. This cancer study with results that are being called unheard of. Doctors using immunotherapy to treat patients with rectal cancer, and the results are in. 12 patients so far. Every single one of those patients in remission.
So obviously that grabbed our attention. So here to explain what this could mean for the future of fighting cancer, NBC News medical contributor Dr. Natalie Azar. Good morning to you.
Good morning, guys.
It feels good to be talking about a breakthrough, something, you know,
it's good to have good news.
Right? Something positive. Yes. So every single patient found out that they were cancer-free at the end of this trial. How stunning are these results?
Well, they're being called unprecedented, and I should note that the numbers are even better than we first reported even this morning. We now have numbers that 18 folks have been enrolled, and 14 of them who completed their 6-month course of treatment have experienced a full remission. That's 100% of patients. Wow. We never, ever say that about cancer treatment. And, you know, we've been talking for a number of years about immunotherapy. We know that it is no longer really novel, but it's different from conventional chemo, right? Chemo is very indiscriminate. It kills cancer cells, but it kills a lot of good things,
so it just wipes it out.
Exactly. And immunotherapy is very different. It's basically harnessing the power of your own immune system to kill cancer cells, which it's programmed to do, but a lot of cancer cells have gotten sneaky and know how to evade that. And what this particular drug that was used in rectal cancer is called a checkpoint inhibitor. It's used in a variety of different cancers. And I love this. It was well tolerated, not a ton of side effects, but the numbers are truly, truly astounding.
And what did the treatment look like? How often were these folks actually getting the shots? Or
So it was an IV treatment that was given every 3 weeks for 6 months. So it was 9 cycles. The standard of care for this kind of stage of rectal CA normally would be chemotherapy, followed by radiation, followed by excision. That means that these people are actually having surgery to remove the cancer, and we all know where that is in a rectal cancer, which leaves folks with a ton of disability. These patients went through the treatment. The most common side effects were like some rash, some itching, some fatigue, nausea. It doesn't sound fun, but certainly manageable and not life-threatening.
This is the kind of cancer that my father-in-law actually had. He survived this kind of cancer. And oftentimes folks who get this kind of cancer, they end up with a colostomy bag as well. And I don't know if you know the answer to this, but with this particular study, were the participants different races, different sexes, different ages?
Right. So for the most part, yes. And when they do these kinds of trials, they want to try to enroll as much as they can, diverse patient population. But I should mention that even they themselves say that this is still very small. It does need to be expanded to include a greater diversity of patients, not just from these academic centers in the city, but from community places as well. And I think finally, it's also important to note, you mentioned your family members, Craig, that only 5 to 10% of patients with rectal cancer have the mutation that was targeted by this immunotherapy. You wish you could say it was 90% of patients. Unfortunately, it isn't.
So, Natalie, what does this mean going forward for other cancers? I mean, as we move out from this.
So the important thing to remember is that as opposed to chemo, which is, you know, as I said, sort of carpet bombing your system, the immunotherapy is not specific to the organ that it's treating. So this immunotherapy was being used for rectal cancer, but other cancers that have this particular mutation is in endometrial cancer. We have a list. GI cancer, stomach, for example, breast, prostate, bladder, thyroid. And these researchers are actually also using it in early stage pancreatic cancer. So technically, any cancer where they can find this mutation could theoretically be amenable. And as we were talking about yesterday, Chanel, if you or a loved one has been diagnosed with cancer, you need to ask your docs, are there clinical trials? Is my cancer one that would be vulnerable to immunotherapy? Ask those questions.
If they don't ask you, you ask them.
Exactly. Don't wait. You have to be your own advocate.
Good news.
Good information. This is great.
And MSK, Memorial Sloan, I mean, this is, you know, in terms of gold standards, MSK is right up there. So.
Memorial Sloan Kettering? MSK. All right. Dr. Natalie Azar, thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.